All right, hello everyone, and welcome back for the next CPH review session. My name's Ashley Mueller, and I am the Manager of Educational Programs at NBPHE, and I'm here to monitor the chat and just facilitate the entire review session. So if you have any questions, as we have in the last few sessions, please put your questions in the Q&A, and the presenter will get to those at the end of the session. If you want to interact with your fellow attendees, you can put questions or responses to each other in the chat section and interact with your fellow attendees, as well as Rich and I can see those as the presentation goes. So today's topic is law and ethics, presented by Richard Payton. So a little bit about Rich. Rich is a public health professional focusing on health literacy, racial and ethnic health disparities, and TG&Z health needs. Rich came to public health after serving 10 years supporting military and federal government. Aside from his work in public health, he is an adjunct at Malcolm X College in Chicago, Illinois, and his education includes a bachelor's degree from George Mason University and a master's in public health from University of Illinois at Chicago, with a concentration in maternal and global health. Additionally, he holds a certified in public health credential. Rich is also a board member for the One Roof Chicago and works as a public health consultant focusing on QTBIOC equity. Richard has published and presented nationally on adolescent violence, sexual harassment, bullying, and risk reduction in vulnerable communities. So with that, I will turn it over to Rich.
Good afternoon, everyone, or good morning if some of you are coming to us from the West Coast, which it looks like there are. Hi, everyone. I am happy to be here with you all today. I will start off by saying this will be a fairly interactive, for as much as it can be, presentation. So please familiarize yourself with the chat. I'll be asking some input from you all, and doing that in the chat would be really great. And I'll be sure to keep an eye on that. Our What we're going to be talking about today is public health law and ethics, and with that is going to come a lot of thought with each of us, right? I want to make sure that we're all thinking things through, and so that's why I want to ask for a little bit of a few of you to be brave and step in when it's time to answer some things in chat. Okay. Also, as she said, my name is Rich. I'm actually a full-time faculty member at Malcolm X College, where I teach in the community health worker program. Prior to that, I worked in various industries within the healthcare community and was in the military and federal government for that. So I'm really happy to be here. I've been working with NBPHE around the CPH and some other issues for a fairly long time. I like to think several years. And I really enjoy the mission and getting to meet people I talk. So if you have questions, again, please feel free to drop them in the chat and we will do our best to answer them. I think as a whole, there will be a chance to ask general questions at the end as well. So if you have questions, you feel free to hold on to them. But if there's stuff that is popping, let me know. Also, I understand this is a very diverse crowd, a lot of people from all over and from different backgrounds and different fields. And so let me know, like give me your thoughts. This is not a presentation where I'm going to be lecturing to you for 2 hours. So I want to hear from you all as well. And some of you may be experts in some of this more so than I am. And so this is definitely a time where I would love to hear your thoughts. Okay. Also, just a reminder, this is an exam review though. And so I will be basing the majority of the questions that we have around exam questions. And when we get to the practice questions, we'll talk a little bit more about what that means. The way I do this facilitation is because public health law and ethics are something that is really ingrained in all that we do. I like to start this process by kind of going back and actually teaching a little bit and learning together about what public health law is, what ethics are, how those things, how morals and all that and come, so that when you're answering the questions, you have that factual basis, right? You have that basis of understanding as we go forth. So With that being said, thank you all. Okay, so public health law and ethics. Today's August 20th. I am Rich. Oh, okay. So you all have probably seen this up to at least 8 times by now. I think I'm your ninth or maybe 10th session. So we know these are different exams. They are weighted differently. They are not so much weighted differently, but they have a different percentage that goes into the overall exam, right? And this part of law and ethics. What this domain talks about is again 8% of the exam. It covers concepts around ethical and legal principles and how that applies. So what that means is we're going to give you the framework for a ethical decision or an ethical aspect of public health, and we want you to be able to apply that in practice, right? What is right, what is wrong, and using it from an ethical and or moral and or legal mindset. Pardon me. Excuse me. So some of the things that we're going to be talking about, kind of what goes into this are knowing what the difference in the regulation is or the different types of regulation, how we implement some of these different systems. We're going to be applying analysis based on equity, based on ethical, based on moral quandaries, kind of how does that work within the real world, right? You want to see not only do you understand what an ethical problem is, but what do you do? How do you act on that in the real world? And then manage, manage potential perceived conflicts of interest. So, what is the difference in conflict of interest and something that just may not be right? What are the ethics and morals around that? And then, lastly, the roles of international health regulations promoting public health access across the globe. So, because we have to understand that the public health laws are not just within our own jurisdiction. It's not just our county health department that is making a rule. These things go as small as your local health department all the way up to the WHO. So, oh, and we try to tweak things to make sure that they stay within guidelines that we want. Okay, so to begin, um, law. So law and public health is, and this is going to be one of the things I'm going to do a little bit of reading from the slide early. I'm not typically someone that enjoys doing that, but some of this is just definition and just needs to be said. So I want to be reading for that. Also for those that are rewatching on the recording, excuse me. So law and public health provides authority, limitations on state power, incentives and disincentives for behavior, mandating, as an example, mandating isolation with the threat of detention, right? Now, ethics in public health talks about providing ongoing analysis, deliberation about, and justification for the public health action and policy. So thinking about when the law is, oftentimes when the law is indeterminate, so it gives the why. So if the law on public health says that we're allowed to mandate isolation because of a threat, or we're allowed to mandate isolation because of a disease that is in the environment, right? So let's say COVID, you have COVID, so we're saying you have to stay within your home, or TB, let's do TB. You have TB, so you have to stay within your home. And I can, by law, mandate that. I can put you in an area and say you are not allowed to leave because of the public good, right? But the ethics part of this is to say that just because I can do that, is that the right thing to do, right? What data shows it? What is the actual impact? Is it more harmful? We saw this realistically in COVID, right? The lockdowns worked, but we had a lot of suffering around mental health and some other things around that nature as well, right? So it's finding that balance, it gives the why to the ability of the legal system in public health. Um, so I'm wondering, this is where you all get to put your thinking caps on. But can you think of a situation where a law provides an authority to act, but it's not clear whether ethically you should intervene? So if you're thinking about targeting a public health intervention for a particular group which might suffer social stigma. So think about if you're in a large community. Again, I know that we're all from different places here, but if you're in a medium to large city and there's a public health problem that is facing a certain community. And so you have ways to help this public health issue, but by doing so, it may cause stigmatization to that group. Like, how do you do that? Is it okay to just say, hey, I'm going to go on and blanket the community regardless of the stigma that may result? Or do you find ways to work within the community and do that in an ethical way? Because the law says that, yes, you can and you should provide this service, but ethically, is it the right thing to do? Um, and then another example, again, is something like TB. TB is something we can be kind of familiar with, where oftentimes isolation is required. And so, at what point does isolation now become imprisonment or become some other aspect to where you are violating someone's rights? Right. And so, that's really what we want to do because we have to balance in public health, we want to have to balance paternalism, right? We don't want to be overly paternalistic. Okay. So, ethics and morality. The differences here are going to be the key difference in ethics is going to refer to our inquiry or examination about what is good conduct, what is good decision making, what's the process, and when confronted with dilemmas about what is right course of action. Morals, when we think of something morally, right? So we've talked about law, then we got into ethics, and we're going to talk about morals a little bit. Morality, on the other hand, refers to our beliefs about what is good and bad, right or wrong. Morality is a social institution. It predates each of us, it's passed along through generations, and people grow up with a basic understanding of moral norms, such as truth telling, keeping promises, not killing, not harming people, right? And so now we look at these three levels of law, ethics, and morality and how they all play into each other. So I would love if someone in the chat can maybe give me an example of an issue that may be a public health law issue, but where ethics or morals may give you some pause around following that law. Are there any examples? Anyone willing to write in something maybe in your work or something you've heard about? I see with so many people, I have people from Scotland and from the East Coast and West Coast. So these things, yes, should hopefully get some really good information. And right, vaccine mandates is a very, very good example. Sex education in elementary schools, perfect. Or I would say sexual health education in any school. Because right nowadays we're seeing more people are having issues around it in elementary school, but we have people that aren't even getting comprehensive sexual health education in high school, right? So that can be a thing there. There's a law in Texas that charges people living with HIV as sex offenders if they committed crime. I wasn't aware of that, Hope. Wow, that's I don't really even know what to say to that. That is decriminalization of HIV is vital and important. And that actually brings up a really good point, right? Which actually relays into all this. But it's interesting to know, and one of the reasons why ethics and morals play such a role in public health, especially around public health laws, because law doesn't always catch up to science, right? Law often drags behind science. So a law, any pretty much any criminalization of HIV law that isn't someone that is purposely giving someone HIV in a criminal way, anything other than that, any laws like that have not caught up with the science, right? Even things such as people not being able to provide blood at blood banks if they are gay or things like that has not caught up to where the science is, and so that's why sometimes we have to use the ethics or the morality around, okay, is someone with HIV a harm to anyone else, right? And the answer is not, in case I need to say that the answer is they are not. So, right, laws on water, providing Narcan. Again, coming into harm reduction is where we see a lot of this. So thank you, Ryan, for that. Laws on abortion, right, or rather laws on abortion specifically. But nowadays, folks are being a little more candid about what the law is around, and so right, access to all kind of health services. And if you're in a place where abortion is legal, whether it be medicinal or not, you have to think about like what is morally ethically right for you as a public health practitioner to help that person obtain what may be a needed procedure, right? Or not even a needed procedure, one procedure, but a health procedure nonetheless. And this goes into things that have been going on for a long time. Even here in 2024, there are places. I used to work for a Catholic hospital where we couldn't give out condoms in the hospital, right? And I get it. I understand. I understand theolo- the theological aspect of it. I see where it's coming from. But the fact of the matter is me as a public health professional, how am I not going to hand out condoms? And what we would do is we would walk across the street, give our clients condoms across the street so we're off property. This is something that we're still doing in the 2020s, right? So you can see, and I'm sure as we're saying these and people are typing these in the chat, I can imagine people thinking, oh, of more things and more things and more things, right? Because the law, again, just can't, and not all to their own issue, but it's hard for sometimes for the law to catch up to science because it takes such a long period for laws to be enacted, right? And that's why we have the ability within the public health community to follow a law, or we have the requirement to follow law, but we have ways where we can institute, where we can do harm reduction programs, right? We can find additional funding sources to pay for sexual health education. There's things we can do where we're not violating the law, but we're still doing what's most ethically correct and morally right. All right, good. Thank you all for that. That was a good discussion. Let's see. Okay, so something that probably looks familiar to far too many of us. We talked about law and ethics and morality, but then and that's on us, right? So when we get told to do a vaccine mandate, or when we tell, and we're going to talk about this in a little bit, MPox, when we have something that's like, hey, there's this new emerging thing, um, we want to go to our community, we want to help, right? But what happens when the community doesn't trust you? And what if that trust is valid, right? There's a lot of when we talk about vaccine mandates, talk about vaccine hesitation, I mean things of that nature. There's a lot of health mistrust out there, medical mistrust. And I used to tell my team when I worked in the clinic when we had patient complaints that it's much easier for us to be able to handle a patient complaint if the patient was having an issue when we didn't mess up. In this case, we've messed up, right? As a public health community, as a medical community, we have to own that. I would implore us, none of us, to be the type to say that was years ago. That's not going on anymore. That's not the kind of doctor I am. That's not the kind of health professional I am. Because it is part of our profession. It's part of where we come from, right? And we've come very far, but as we know, there's still a lot going on, right? We have not medicine nor health have gotten to the epitome of the moral high ground yet. Okay, that aside, so we look at this and we know that some of the regulations that we have to follow have been written out of tragedy, right? When we think of things like uh, the Nuremberg trials, right? When we see what has happened with even a lot of the doctors and stuff that have been in the U.S. over time, Dr. J. Marion Sims, who the father of modern gynecology is often called, but that came at the risk of hurting, harming slaves, right? And just women in general, but primarily slaves. And so we've had amazing advances in healthcare, but at what cost? And so when we as public health professionals are facing an emerging issue, a COVID, an MPox, TB, when we go in the community to try to provide services, we have to be aware that we may not be accepted wholly, truthfully, and why, right? And so that's where this also comes in because ethics in medicine is going to have it's going to basically talk about the regulations we have to follow now, right? When we ask for informed consent, when we have to do things such as go through an IRB, even for a research project that doesn't involve human subjects, you have to have an IRB approval, um, because we want to make sure that we're doing the best that we can to protect people, and we still fall through in that, right? And so that's part of this course as well, is understanding the where these laws came from why they are and why we and how to apply them in today's world. Okay. So I want to ask a couple questions here again. So I want you all to chime in the chat, please. So what are some accepted moral norms and values in public health? What are some things that are in public health that we just say are accepted? Okay, healthcare is a human right. Good. Thank you, Hope. What are some things that we just when you go to work every day and they're like, oh, this is something you don't have to worry about. You just know it's fine. Right. Okay, do no harm, health equity, reducing disparities, clean air, clean water. Exactly, right. All this is coming around that same thing. Be good to people, right? Be equitable, practice equity, not just equality, practice equity. I think you all learn get more on that in one of your next sessions. Right. So these are things that are as part of what we are supposed to do. Now, do those things differ from moral norms in medicine? And what about in the law? Like, are there things that maybe, and I apologize. I apologize. Um, so I asked things like this, right? Like, what are some norms in general that are in public health that may be different? Like when are we going to be in the hospital or the clinic and we're arguing with the provider about a patient care, right? Or about a patient follow-up? Because those things happen, right? And it's valid. Right, mask mandates are people, but are illegal in some places. Good point, right? So there are things that we can say, or in public health, a good example would be one of the things earlier around needle exchange programs or Narcan. Believe it or not, some people are not fans of Narcan. We think about some really radical things like safe use facilities, right? Things like that, which may be a public health win, but medicine, excuse me, or law may find it not as much. And we can think about this in a lot of different aspects around, again, medical abortion as one way. We can talk about harm reduction around needle exchange programs. That's always one that's been really, really big where it is technically illegal, it's drug paraphernalia, but it's harm reduction, right? We know that needle exchange programs help, right? Or, and again, more radically, if you think about a safe use facility, those that don't know what a safe use facility, it's a place where if a person has substances, they can come and use them within the facility. There's usually medical personnel there. So if there's any issues, they can handle it on site. There are things like phone calls you can use while you're using so that if there's an issue, you have someone there that can call the police and get or call an ambulance and get people to you, right? These are things that we made that if you are a public health professional and you have and you're a non-medical, non-MD physician provider, public health professional, you have a lawyer sibling and a physician sibling, you all can have very interesting conversations about where these things complement each other and where they kind of diverge, right? Okay. So now we're going to, and then what are some ethical issues and conflicts we're facing today? So we're going to talk about this next one in a bit. Actually, so I'm going to go to chat and look there real quick. Different, right? Morally, they shouldn't differ in medicine, but they do, right? It shouldn't differ, and you can see where it differs in law. I remember and this is now I'm still a baby public health professional. So this was probably 2015, and I was in a global health course, and one of the physicians who was finishing his residency and was getting an MPH, and talked to and still said this about how he assessed pain differently in his Black patients in the ER. And he said this in the middle of class. And what made me like kind of gasp was not even the fact that he thought this. Because I know it's people still think, but he had the audacity to actually say it out loud. And so, right, sometimes public health and law and medicine are a little further apart than we would like for us to be, right? Yep, doctor are focused on the health of one person. Public health is looking larger, right? So it can be another thing, right? Is it important to give this person this vaccine? For example, MPox, and we're actually going to talk about MPox in a moment, but So MPox, commonly known also as monkeypox or MPX, had a couple different things. And so one of the things when they started, so with MPox came out a couple years back, there was a vaccine that came out, which is actually smallpox vaccine that you can use to actually treat and to prevent some exposures. One of the things was though is that if you knew what you knew and you saw and you got the vaccine, it left a noticeable mark, right? And it didn't last forever, but it lasted just long enough. And I had to explain, or I attempted to explain to the city of why this can be an issue. Because if you are someone that is DL, or if you're not someone that's out with your sexuality, but yeah, you are someone that would be at risk for mpox, having that little pustule on your arm could be a giveaway to people, right? This could be as much as saying, "Hey, I have crazy wild sex, and I need to have mpox vaccination." Not what that means, but that's a stigma thing that can happen. And so this may be a point where medicine and public health would differ about, hey, can we do it somewhere else? Is there another spot we can do this? Is there another way to administer this? Which they end up coming up with later on. But those are some of the ways where those things can kind of intersect. Um, and I can only say I hope his education also changed. I let him know at that moment that that wasn't the right way to do things. So don't know if that had any impact on that. But the point is that these are things that are happening, right? Okay. So now I've talked a little bit about MPox. We're going to talk about this from a ethics aspect and then from a morals aspect. So as a review, because again, I know we have people here from all kinds of fields, right? We have environmentalists, we maybe even have some public health lawyers in here. That'd be great if we did. Lots of people from lots of different backgrounds. And so MPox, I'm going to give you a quick back understanding of MPox. MPox, again, before it was known as monkeypox, we updated the name to be something that is less stigmatizing, right? It went through a couple variations. I think MPox is where we actually landed at now. It is actually getting a resurgence again in the last month or two, which is interesting. But when MPox first came, so I'm in Chicago. When MPox first came kind of into the US, Chicago was one of the hot spots. And it really just started affecting initially gay white men in their like 30s and 40s, right? That was the population. And if you know anything about MPox, you'll understand why. It's because it came because of how it traveled back to the US. But so we were having meetings about what to do about this new thing that's in the community that is mostly affecting uh gay men or people that have sex with men that have sex with men, or and actually that was it. And it was very interesting because this wasn't affecting trans women as much. It was more sex with men. And so we said, hey, we can use the smallpox treatment or smallpox vaccine treatment to actually treat and or prevent mpox infestation. And but the issue was we didn't have a lot of this vaccine. And so what they said was you can only get the vaccine if you are uh, a male who has sex with males that has done so within the previous. I think it started out as like 6 weeks or 4 weeks or 2 weeks, but it was within the last period. Or if you are regularly someone that has sex with someone that has done so, or have traveled and whatnot, right? So it had these very specific stipulations. One of the things that stood out about that was that it was saying only for people that may have had exposure, not those that could be being exposed. So if I haven't been to a sex party in 2 weeks, I can't get this preventive vaccine, even if I'm going to one next weekend. So that was one thing that happened. The other aspect was we have this community that is already over targeted, right? Over targeted. And we also know from COVID and from pretty much anything that happens health wise is that it usually starts with that white group and then it goes on and gets worse and worse as it gets into people of color, Latin, indigenous, and black folks. And so we wanted to make sure that the city was able to highlight the next wave of people that were going to be possibly affected by this, and they didn't, right? And so this was one of the issues we had, and so we had to deal with the law of who we couldn't vaccinate. We had stipulations coming down from CDC about the criteria for vaccination. So then me as a public health practitioner, as a running an HIV clinic, and I have people coming in saying, I would like to get the MPox vaccine, and am I supposed to just say no because you haven't had sex recently, or no because you are a cis Black woman, right? Does that make a lot of sense? How does that work? And so how do we look through the ethics of that, and how we look at the morals of it, right? What are the moral rights and wrong? Was the city, or I say the city, but really the city and the state and CDC, were they right or wrong? Were they morally right or wrong in stipulating who can and can't have the vaccine, right? Were the practitioners that maybe accepted that cis Black woman because he knew that she was going to be maybe engaging in something this weekend and vaccinated her despite not being allowed to? Is that okay? Is that right? Is that legal? Is that ethical? Is that moral? Right? Some of these, as you can probably tell, are not a good, there is no right answer, right? So these are not the kind of questions you'll have on the exam, to be clear. This is more for you to be thinking about and having that framework. But it's a thing, something you should be thinking about, right? If the law says, or not even the law as in a law, but if there's a regulation saying, hey, you are only allowed to use this medication for this predefined group with no like variation, then what do you do when it comes out to someone that you know needs this medication? What do you do? Right. And that's why we have these courses, because those things are going to affect us as public health professionals, regardless if you are a public health lawyer, if you're a public health nurse, if you're a public health doctor, if you're a case manager, if you are working at the SNAP office, right, or in the WIC office. Because all those people, if you know someone at the WIC office, they should be in these classes too, and they should be getting certified because this stuff is important for them as well. Um, but these are the things that we really need to be thinking about. And as we move into talking more about the exam and getting into some exam questions here, having that basis of what the difference in a law is, what a moral aspect is, and what an ethical aspect is, and how we apply those things, right? As we get into, actually, so let me move into this. Okay. Okay, we'll go to quick Q&A. Before we get into actual exam practice questions, I did want to see if there's any questions in the chat, or if there are any questions for me about the presentation, about anything I said, anything I was like really good wrong, really good about, or really wrong about. Let me know. Shouldn't be hopefully too much on either one of those sides. But take this opportunity if you need to put anything in the chat, questions or comments, before we move into and I start talking about the exam prep questions. Okay. And while I give you all the ability to do that, I will start just briefly talking about the exam. Again, I know you've heard this numerous times. The questions that we're going to be going over, I think we have, I don't know, 15, 20 or so questions, maybe more. These are questions that have, in every course, every course that you take in this series is going to be a little different. These are all questions that have been retired from the exam. What that means is that either they were questions that were written really well and they just ran their course, right? We used it for several years and we took it out. Or there were questions that maybe didn't score well. So what will happen is you'll take these questions, or you'll take the exam, and then we actually look back, NBPHE, not we as in me, looks back at, okay, maybe 95% of people got a question wrong. That's probably not a question we're going to keep on the exam, right? So we'll pull that question. And there's a lot of other intricacies there. I'm not going to get into that here and now. But these questions are going to be questions that have been asked or were part of exams, or were written for exams. So these are things you will see. Some of these questions are honestly not written well, and I'll stipulate that and tell you that, so you know why these questions were taken out the exams, just so you know what to expect, right? Because we've been doing this for a long time, and all the questions weren't always super great, and that's important to know as well. Okay, yes, Pixel 7, I will differentiate between those one more time for you. Got you. Okay. Also, so the best way to take this exam is to, like the exam in general, the practice questions here, but the exam in general is, these are typically written in a way where you can have, there's a right answer. There's questions that are going to be very similar to that answer sometimes, But then there's usually going to be what we would call a couple throwaway questions. That means that it's something that is valid but probably isn't right, right? And it should be fairly obvious pretty quick that one or two of the answers aren't actual answers and aren't right. One thing we will not do is trick you. We have gone through a lot of iterations of this exam to make sure that we're not going to try to trick you and give you trick questions. You won't see any any questions that are like the most thing or the least is gonna you may ask you for like the most correct, but it won't be anything that's super ambiguous. And so all right, we're gonna get into a few questions, but to back up, okay, so yes, let's see. Law would be Casey says law would be written regulations or rules to be followed. Right. Lay terms, law, and law can be it's going to be a law, and you should remember this, a law or a statute, some sort of regulation that tells you how to do something. It defines you will do this way, right? We think about common laws, or not literally common law. We think about laws that we're familiar with. Stop signs. You will stop at a stop sign. It's not ambiguous, right? Stop at a stop sign, or you get a ticket. Um, things like wearing your seatbelt. I think at all 50 states now, seatbelts are fully required. So not wearing your seatbelt is against the law. It's a thing, right? Now the ethics and morals part comes into where if you get stopped by the police for that seatbelt violation or running that stop sign, they may or may not give you a ticket. That's their discretion, right? And not to talk about cops, but that's their discretion, right? So that's them having that ability. And so an ethical thing, or let's see, right. And so thing, an ethical issue or an ethical lay definition would be using the information you have to make a decision about that law, right? Like the why. So when you think about ethics, think about the why. So if the law is do not run a stop sign, the why is because when people run a stop sign, they get into accidents, people get hurt, things of that nature, right? We know that running stop signs or not having stop signs at corners gets people hurt because we have data. So we look at the data and said when there's no stop signs, people get hurt a lot more, right? And so that's the ethical thing for that law to say, okay, is it ethical to have a stop sign at a busy intersection? The answer is yes, because if we don't, people get hurt and die. Right. Now, the moral aspect is more what you believe in, right? It's how you were raised, it's your own values. Um, I can't really think of a good way to apply that to the stop sign analogy. It's how you feel about stuff, right? So when it comes to TB, when it comes to the MPox, it's are are you morally do you feel okay with giving that vaccine to a person who doesn't fit their criteria, but you think is the right fit, right? And that's not just I think it's the right fit because I think everyone should have access to healthcare. That's not it. It's I think that this law is well intentioned or not, but may not be meant for this particular person, right? It may not, the law has not reached down to this point yet. And so that's kind of different in the moral there. Okay. So Storms, yep. So perfect Casey. Okay, and then if Pixel 7, let me know if that makes sense. And again, we're gonna as we go through the this is a as you probably have seen, this is a shorter lecture portion. We're going to go through a lot of questions. And so as these come up throughout some of the questions, feel free to again ask, hey, what about this? What about that? Um, so what we're going to do is we move into the questions. I believe Allison is going, I'm sorry, not Allison. Sorry, Ashley is going to I think populate polls. And
Yep.
I'll actually also have the screen or have the question on the screen. If they don't sync up perfectly, give us a second. It's my fault, not hers. But we're gonna go through that. Okay, so again, just quick review. We're gonna move into the lesson. We're gonna move into the practice questions. Some of the early ones are pretty easy, but still take that extra moment. Think about what doesn't before you find the right answer. Just do me the favor, please take that extra second and say which one of these may not belong, and then you can pick the right answer, right? Just because if you get into the habit of doing that early, when it gets to the harder questions, it'll be a little bit easier. All right. And we're gonna get started. Okay. Oh wait, I guess can you do the if you do the poll first, I will go to the question, and then if it's the wrong one,
Okay,
I'll move it to
sure. Yeah.
the. And thank you all for your patience here.
All right. So the poll is which is the following historic events raised awareness of the need for protection of research subjects and resulted in the 1949 creation of the International Code of Ethics for Research.
Thank you. And I can read it from here on
Yeah.
out. A very wordy question, but valid. So go ahead. You all can answer this as you think about it. Again, try to think about which one is obviously a no-go, and then work down from there.
Yeah. I'll leave each one open about a minute. So get your
Oh, shucks. Sorry. Wait. No, wrong way, wrong way. Okay.
all right. There you go.
All right. Good. Nazi human experimentation. So just to go through some of the other answers, that it is not Willowbrook hepatitis study is was later. Belmont report was also later. Tuskegee was way later. The kind of key, excuse me, the key giveaway here was 1947, right? That should have been kind of the giveaway. Yep, right, Nora. So that's another thing. Find your keys. Now, I warn you not to over focus on like a particular part of the question because it may throw you off, but something like this is right? 1947 goes right with the Nazi human experimentation. Okay, next. Yeah, okay, got it. All right. Which of the following United States federal laws prohibit a public health practitioner from sharing individually identifiable health information stored on public health department computer systems? All right. Good. HIPAA, Health Insurance Portability and Accountability Act. Right. So this is one you just gotta, this is what we call a recall. You just gotta know. But some of the kind of key things is I don't think we often think about this because it's so common now that all of our health information is on computers and things like that. But that's really what this is about portability, and how we store and how we move people's health information around. So that's kind of the giveaway here. But also just knowing HIPAA, right? If you never knew what HIPAA stood for, now you do. Health Insurance Portability and Accountability Act. Okay, great. Next is Okay, we can go next. Right? I'll say the management of a healthcare facility requires staff to adhere to ethical principles and provide culturally appropriate care. The institutionalization of these values is most likely to influence which of the following aspects of healthcare provided by this facility. Now, this one I want to actually have us hold on for a second because what I want us to do is use this to break down a few different things. Um, so The this is a question that would actually be a little bit shorter in the exam now, because it would probably that first sentence we would take off, and so because that's not super important, it kind of is. But the institutionalization of these values is most likely to influence which of the following aspects of healthcare provided by the facility. Now, if we decided, okay, two things we want to break it down and move away from. So we look at acceptability accessibility, accountability, and adequacy. Okay. A lot of words, they all look kind of really funky and look the same and sound the same. We can look at what each one's mean, or if we know what each thing means. Accessibility is the one that I find to look common, right? Accessibility is talking about the ability to have accessible spaces, right? That means wheelchair ramps, that means working elevators, things of that nature. Now, while that's important, is that really going to be what we're looking at here? Because we're talking about culturally appropriate care, right? Not like medically appropriate or accessible care. So accessibility is one that would be I would think about, but as I read through it, that's probably not going to be it, right? And if I look at let's say accountability or adequacy or accountability, adequacy or acceptability, I want you all to go ahead and from those three think about which is you think it would be most correct. So go ahead and answer now, thinking that accessibility is not it because that's not, it's the wrong type. So go ahead. Right? Cultural barriers could impact accessibility, but accessibility has a very specific meaning, right? Especially within health and within hospitals, right? And I mean within everything. When we see it in places we don't actually think about, right? If you look at your computer and making your monitor darker is an accessibility aspect of it, right? Having PowerPoints that have links is accessibility. So those are things we don't think about, but that's in everything we do. So that's not culturally appropriate. It is culturally appropriate, but it's not solely culturally appropriate, right? So that's why, and that's one of the reasons why I told you ahead of time that that wasn't it, because a lot of people get mixed up on that. I want to make sure we can separate it into what's up. So, but that's a good reason, right? And so I mean, that's why I actually mentioned that, because it could be a little bit ambiguous there. Okay. Let's see. Okay. So a pretty good mix here still. Now, so the answer is actually acceptability, and we'll talk about why. So adequacy is again, if you take off the acceptable, accessible, accountable, and adequate. Being adequate is not what we would call culturally appropriate, right? We don't want it to be adequate. We want it adequate is the food tastes okay, doesn't get you sick. That's adequate. That's not really what we want, right? And that's not going to be providing that again, that culturally appropriate aspect. It's not going to be the value of adequacy. Acceptability is the answer here because what we're doing is ensuring that um, the community and the staff are working together, right? That we're being culturally appropriate and things like that. So again, that was a harder question because it's a hard question. A lot of words look a lot alike. Something that we see accessibility, our mind goes right to that automatically because we're healthcare professionals. But you want to step through it, and so again, that's one of the reasons we had that as a question, so you can step through it and kind of walk through each question. Okay, ready for the next one? Oh, it's not accountability because you're not accountable to anyone, right? It's not about accountability with being if you are trying to let's say if there's a interest group within the community that needs a specific accommodation or something like that, right? And then you make sure you get that in and then being accountable to them for keeping that up to date or keeping up to date on your uh you know any of your like your wordings and your manuals and things like that, right? That's accountability is being able to account for, I hate using this definition in the term, but being able to account for what is being done and what has been done. So yes, wouldn't be rejected by the community is kind of the idea there. So okay, good. All right. Thank you, Ashley. Let's see. Okay, when a public health issue emerges for which there is no evidence base to suggest a response strategy, which of the following actions on the part of the public health professional is most appropriate? Okay, so this is one where we're going to give you maybe a minute and 10 seconds. But look at the answers, read all the answers first, and then this one we should be able to drop two off and then kind of see what two are left and narrow it down from there. But read through it. Again, this is one that's a little wordy. We may or may not, trim this down in the current exam, but this would be a good question. So go ahead. Sorry, what I was saying was that the questions weren't missed. My questions are off. One, I have an extra question in here that Ashley doesn't have, so ignore my question number. Hers are correct.
Mhm.
So that's my bad. All right. Good. Wow. Okay. You all. This is good. This is perfect. So I guess I should show you the answer. The answer is yes. Invest in data collection and community-based research. Um, to build more thorough understanding of the issue. So the reason for this is let's cut out the two that we definitely wouldn't want to do, right? So dismiss the issue because there's insufficient evidence to make an informed decision. That's not something you want to do, right? That's a throwaway. It's a throwaway question there. Um, defer action on the issue again until further information. So again, could be that could happen. It probably does happen, but it's not the right answer, right? That's not most appropriate. And then implementing several different strategies at once. So C actually happens more often than you think. Oh, is my audio still down?
No, your audio is fine.
Oh, okay.
It's one of
Um,
our attendees just said they didn't have
Okay.
audio,
Sorry, I
so
just looked at that. And I
yeah.
was muted for a second, just in case that was an issue earlier. But anyway, sorry. So implementing several different strategies, that actually does happen, not infrequently. You just throw a bunch of stuff at the wall and see what happens. We kind of did that with COVID a little bit, right? Distancing and masking and wiping everything down. And these are like what actually works. But the right answer is yeah. And take the extra minute, right? Take that extra second to invest in your data collection, find out about community-based research that can actually communicate to the community what's going on and understand the issue and then actually act. So that's the right way of doing that. Okay. Great. Okay. So this is one I actually did hint at earlier. So hopefully you all saw this and were listening. But which source of United States law gives power to health departments? So think about what each one of these four things mean. And right, Ryan, from what you said before, A and B don't really do anything because it defers or doesn't do anything at all, dismisses. So correct. But All right, so there's a question and oh, I see that the answer as well. So there was a question in the Q&A I just want to address real quick, asking about the a question. I think I'm assuming it was about HIPAA, but in general about US centric questions on the exam. And just so you all are aware, we try our best to not have US centric questions on the exam. Um, every time, actually, every single question we go through that you see on your exam, we actually have to answer ourselves. Is this US centric? Does it have to be? Right? And questions about HIPAA, Health Insurance Portability and Protection Act, will always be on the exam because that is something that's big enough that we feel like even internationally, HIPAA is something that we want people to know about. That the vast majority of people that are studying for this will come across and understand what it is and that it's important. So that is one of the few US specific things. Most stuff on here we try to not be US specific. But that being said, the question on the screen now is also US specific, but this is a law and ethics section, and then if we didn't do anything US specific in here, this section would be like 10 questions, right? And we would all know what those 10 questions are. So yeah. The other parts of the exam, you'll see far less US centric things, but in a section, you'll probably see a few more than you would normally. But we are aware, and any US centric thing on here is going to be US centric, but like we know that, right? And we account for that. So hopefully that helps. Thank you for that, whoever that was that had that. And if you have questions or comments about things like that around accessibility or equity or things like that for internet, please let us know. Those are actually things that we do take into account and really do listen to. So I wanted to make sure I just addressed that. So okay. Now this question, which source of US law gives power to health departments? Now, I realize I probably, hopefully I didn't, but I may have swayed you all on this both. Okay, so the answer is statutes. Treaties, no one said, so that's great. Common law is common law, right? So it's not something that's everywhere. It's an accepted law in certain areas. There are certain commonwealths and places like that where common law is, but it's not the source across the board. Statutes are. Statute and law are basically the same thing, right? The reason why, and if you all said this because of me, I apologize. I did say earlier, law and statute are the same, but I often use the word regulations as a general term for anything that gives a process for doing something. But that's not a law. Regulation is not something that has to be can be punishable or can be enforced, right? Statutes, laws can be. So yeah. So for statutes, the answer to statutes, regulations is not appropriate here because regulations is more general and it's not an actual law. A statute and a law are the same. That's kind of what we went through there. Good. I'm glad no one said treaties because we're not thinking international, right? Now there are some treaties, just for those of you that didn't answer this because of why, there are some treaties between the US government and like indigenous populations within the US. So that's a thing, but yeah, typically treaties are going to be not with domestically. Okay. All right. And I think that might actually one of the last few US central questions as we move on. Okay, next. We have voluntary evacuation plans for medically fragile individuals in a declared state of emergency need to be analyzed in terms of which of the following ethical principles. So here we're thinking about ethical principles. Make sure you're thinking about that, right? That's kind of the key in this one. All right. So Good. A lot of people got this right. Protection of individual liberty. Okay, so incorporation of diversity and acting on information in a timely manner are the other ones that were answered. Um, let me see. How can I explain those? Okay, so one thing to, and I think you all probably caught this, is that voluntary evacuation was the key to the individual liberty. So let me get on that, right? The one reason this is the correct answer because voluntary evacuation and ethical principles, right? Whenever possible, we want to always try to protect a person's individual liberty. We talked earlier a little bit about paternalism and the ethical aspects around some of the different laws and how, the why of it. We always want to ask the why for a law because of individual liberty. Anytime we're taking away someone's autonomy, we want to make sure you have a really, really, really good reason for doing so. Um, Corporation of diversity is not the best answer here. Just because it's not about diversity. Again, this is just similar to how the other question wasn't about accessibility. This is just not about diversity. This is about evacuation, right? And individual people. So it's diversity in this aspect would be like, oh, you're only allowing, certain people to be able to evacuate, right? And that would be a diversity issue when you're not doing that properly. And acting on information in a timely manner is important, but it's not an ethical issue, right? That's just a administration issue there. Well, okay, good question. Good question. So Barb asks, how is it protection of liberty if it is voluntary? You're not taking away autonomy if it's voluntary. Right. But because this is a medical facility, right? So it's medically fragile individuals. And so the reason why it's protecting their liberty is because they may need to be someone, the city or the county or the hospital administrator may be saying, okay, we have this storm coming in, everyone has to go, but that may not be the law that's coming down, right? It may not be yet. It may be that since it's voluntary, they can't force you to do anything. And so your nurse or your doctor or whoever may want to make sure you leave and make you leave, but they can't do that because of your individual liberty, right? If you're in a hospital and you're hooked up and it's not mandatory for you to be kicked out. That's kind of the why. Okay. All right. Thank you. Okay. We'll go on to the next one. So this is another pretty wordy one. So a health department received a confirmed case of measles in a 10-year-old. The health department has been asked to exclude all unvaccinated students from the school for 3 weeks to attempt to stop the spread of measles. The county administrator is concerned about excluding healthy children from the school and the backlash from an anti vaccination organization in the community. Although it is legal to exclude children from school, the health department needs to determine what choice is ethically defensible. Which public health ethical principles are in conflict in this situation? So I'm going to reread those last two sentences because those are super important. Although it is legal to exclude children from school, right? The health department needs to determine what choice is ethically defensible. That's what you talked about. The law is that you can exclude kids, but the ethical aspect is the why, right? So, which public health ethical principles are in conflict in this situation? So this is slightly similar to the previous question, but a little bit different. I think a little bit of a better example, although a lot wordier question.
I'll leave this one open a little longer since it's so long to read, just in case anyone needs a little more time. All right.
All right. You guys are killing it over here. This is good. All right. The answer is B, respecting the rights of individual community members versus addressing the fundamental cause of disease, right? Like we just mentioned, we always want to try our best to err on the side of individual liberty or autonomy, whatever that is for the individual. But also, we have a disease that we need to be able to fight, right? And so the things that are in conflict here are going to be the rights of the individual members versus the fundamental cause of disease. We know that the disease spreads through proximity, right? So that's the difference there. Just briefly, building power, the public's trust, just empowering disenfranchised members to ensure health access. Building the public's trust doesn't seem to be the biggest issue in this, and that's why that's not something that they're saying in the blurb there. Acting on health problems in a timely manner again is important, and maintaining confidentiality, that's not the issues here. Those two things are important, but that's not the issue in the question. And then respecting the values and whatnot are important. Uh, but implementing a program that enhances social environment. This isn't about social environment, it's about medicine. So that's why it's B. All right. Um, okay. A research group is examining factors that contribute to diabetes among underserved Latin adolescents. Parents provide informed consent for their children to participate in this observational study. As the study is only observational, no intervention is planned. 2 years into the study, the FDA approves a drug that has been shown to prevent diabetes in adolescents. The research group continues to conduct the observational study without change to their study procedures. Which of the following statements is true about this research group? So look at this, and you're going to be outlining the issue there. If there's an issue, uh, yeah. Again, this is one where you can maybe cut off two right away, or at least one. I'd love to see your thoughts on this. All right. Good. So we have the top two answers here, so we're going to address those. The answer is behaving unethically by not informing participants of the available treatment. The reason why number one is incorrect, they're behaving appropriately because the study was designed to only be observational in nature. While that's true, when you find someone, when you find even though it's observational, when you find the cure, you use the cure, right? That's just a thing. So your study design may change when they find a way to actually solve whatever you're studying. You can think about this in Tuskegee, right? If you aren't aware, once a treatment for syphilis came along, they still didn't provide it to the gentleman in the study. So that was the issue, is that they were still observing them and they did not give them the actual medicine. So this is actually directly related to that. So, all right. No, it isn't, because if you take the new treatment, you'd be out of the study. The study is over with because they're studying it not being treated, right? It's underserved Latinos. And so once you start serving those Latinos by giving them this new medication, it's no longer observational. And if you start giving them medication, they can't be in study anymore because they're not untreated diabetics. All right. Good question though. Good, good. I like where you are. And please ask these questions about things that you may have gotten wrong, because that helps me explain to you, and someone else may have the same question along your thought process, right? It's not that that's what this is really about, making sure your thought process is going the right way, right? Reading through, and again, getting you at access to some of these questions and some of the way some of these things are written. So good, thank you, Ryan. Okay. So, the correlation between social status and health in economically developed countries is most likely explained by which of the following? Wait, I think this is the one we're skipping. Hold on. Let me see. Yep, we're skipping that one. We're gonna go to the next one. Right. Okay. So, um, this is kind of hard for you to read on the screen. I'm not sure. I'll try to make this better, but healthcare facilities share patient data through health information exchange networks. Which of the following pairs address the definition of a covered entity among data recipients and procedures for creating public use data sets de-identified as personal health information? So again, you can here you should definitely be able to take two out, right? Look at what's left. And remember, we're not trying to trick you. So whatever you think the answer is probably right. Don't overthink it. All right. So the answer is HIPAA, Health Insurance Portability and Accountability Act. Um, let's see. ACA is yeah, ACA is just general, right? Excuse me. So it doesn't fit there. And then okay. So I'm gonna move through these a little bit quicker just because the it has the answer on the page. But if you have a question about an answer, let me know and I can go back to it. These I see now these are not very easy to read. But if you have a question again, just throw it in the chat and I'm happy to go back to a slide. But for some of these, I don't want to, if we know it, I don't want to spend too much time on them. If you all know, I have no problem taking more time on questions. So don't read that the wrong way, please. Let me know if you have questions, but we're gonna move on. Yes, you should definitely know what HIPAA is. You should know what ACA is. Cobra, you don't have to know. That's like an insurance plan. Like if you know it, cool. You know it's a throwaway. Um, yeah. But yeah, you should know, everyone should know HIPAA. Everyone should know Affordable Care Act, Obamacare for those of you that are more familiar with that way. But yeah, so those are laws and things you should know. But those are laws and statutes that are directly related to healthcare. And I'm telling you, so now you know.
And I'll say sometimes if there's something in there that you don't know, you're like, Cobra, what is that? I would put that in the list of things like this is probably not the right answer and focus on what you do know.
Good, thank you, Ashley. And that's the same thing you're asking there, right? Yeah. So safe harbor conventions and consolidated omnibus Cobra, again, those are things. That's a throwaway, right? Every question is going to have a throwaway, right? Everyone, there's no gonna be no question where it's like all four of them are like, oh my God, these are so close. No, 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 no. I promise you, every question has a throwaway. Throwaway may not be as easy as some of the other ones, but there will always be a throwaway. I promise you. Yes, but A is the right answer. Whenever you're thinking about and just in your practice in general, right? Aside from the test, 95% of the time, if you hear portability, health information, and portability or security, it's almost always going to be HIPAA. So, all right. So we're gonna move. Julie, no, no, no. The answer was A. It was Health Insurance Portability and Accountability Act. Okay. There were two with HIPAA. Right. This is the one with safe harbor conventions as opposed to Cobra. Cobra is an insurance. policy program. So that's the difference there. Okay.
And I
All
think the
right.
key with that one is the difference between the Affordable Care Act and Safe Harbor, right? Because
Yes.
yeah, yeah.
Right.
So yeah, that one you'd have to eliminate between those two and know the difference between them.
Actually, I'm gonna do this for you all too. Hold on. Give me. What I'll do is I'll give you. So this is a bigger explanation. I'll post so that you all know because I'm not giving because of timing and everything else. I want to give you like what Cobra is, what is. But I have the explanation here. I'll actually copy and paste that into the chat in a moment. So I'll do that in a second. All right. Because I want you all to have the. I'm not trying to hide. I want you all to have all the information, but that would be too much to read right here and right now. So I'll give you the information. All right. The next one, administrative law judges who adjudicate conflicts involving the decision making of units of government agencies. Now, this is one again, you may not know. You may be like, I don't know what an administrative law judge is. That's fine. Now you know to look it up later on. But these are the kind of questions that are like just general recall that are going to be a part of the law and ethics session because this is a public health law thing, right? So all right, while you're doing that, I'm going to. Okay. All right. So this one was a little bit more split, but Lottie, you got it right. Good job. Ensure compliance with constitutional requirements of due process. So administrative law judges are there to ensure compliance with constitutional requirements of due process. What that means is that administrative law judges are folks that are selected and appointed that handle things that don't rise to like a federal bench judge level, right? So you may have heard things like magistrate, stuff like that. Um, but second. So here's the question again. So like if there's a dispute between like a citizen and EPA or the EPA and the DOJ, right? Some of those things can go to administrative law judges before they move up into the other courts. Okay. Good, Kathia. Kathia, I apologize for not pronouncing your name correct. All right. Okay. Question three. Um, so public health law fundamentally attempts to balance the greater good of the community with what? Oh, so the answer to the previous question. Let's answer this one, then we'll go back to the previous one. I'm sorry, I moved away from that one too fast. I apologize. But let's answer this one, then we'll go back and I'll make sure everyone's clear on the last. Yeah, these next few questions are going to be a little bit more recall based. I'm trying to get the right word, recall. So knowledge
You're right.
definition.
Yes. Yes.
Oh,
Recall. So these are kind of the things that you have to probably a little bit memorize what they are more than
yeah.
applied.
All right, we should be good here. Good. You all were listening to me earlier. Yay. Again, autonomy of the individual here. Acceptability of interventions is important, right? But acceptability, we talked about a little bit earlier. It's not about whether something is going to be accepted by the community or by the people that are going to be implementing it. That's not the main point here, right? It's really about balancing. Because remember, this question not asking what public health law is saying, what is it balance? And it's the balance of the greater good of the community with the individual. Yeah. And then cost of implementation isn't super important for public health law at this stage. It can be deeper in, but not at this stage. So, all right. And then, oh, I didn't actually, I'm sorry. Yeah. So this is the reason why autonomy of the individual gives you the explanation here. And I'll give everyone a minute or so, not literally a minute, but a little bit of time before I move on to the next one. And I will actually go back to question two to make sure we're all clear on that one as well before we go on. But or to my question two different, yeah. Okay, so I want to go back to this one. So the question being administrative law judges who adjudicate conflicts involving decision making of units of government agencies, ensure compliance with constitutional requirements of due process. So that's the answer. That's what administrative law judges are, right? That's their role in the judiciary, right? Or I guess actually executive branch. That's kind of what they do. That's their role. And then this is giving you the reference. So if you want to take a note and just write down real quick what this is. Again, this is not something you necessarily need to have for the exam, not all these references specifically, but knowing the role and or what the role of a judge is important. These are not, but if that's something you want to have, I will go ahead and give you the opportunity to have that as well. So yeah. Okay. So the questions in the exam they're not per question. You have an overall time for the exam, right? And then what happens is some questions you're going to answer in 5 seconds, 10 seconds. Some questions you're going to answer longer. So there's not a per question thing. People have different exam taking techniques where don't spend more than I'm not going to get into that. That's not how I take exams, but everyone's different. And so I don't want to knock that. What I will say is that you my experience, the people I've talked to before and after have all had ample time to take the exam. I will say that. I will say that I had ample time to take the exam, and I'm very slow. And I was double checking because I was really scared, more scared than I needed to be. Don't be like me. Um, but so as far as how long, it's not a per question really answer. Some will be quicker, some will be shorter. As you've seen through these questions, right? Some of them you get through, oh, that's easy. Boom, I know that's HIPAA, that's autonomy, that's and the other one's like, well, I need to think about the theory. I need to think about what does common law mean? What does a statute mean, right? So it's going to be a little different. Well, what's an ethical? If I'm being asked an ethical question, it may take me longer to actually think through the ethical implications of it, as opposed to a simple yes, no, true, false. Or we don't have yes, no, true, false, but like a simple recall definition. Okay. All right. Oh, well, never mind. She did, but Richard, you spend about 1 minute per question. Okay, so I didn't, and I apologize. I know that was positive. That makes sense, right? Not spending much more than a minute because even the ones that are like math and things like that are based, if you keep it around that, the ones that are shorter, you'll make up the extra time. So if you end up spending a minute and a half on one, you've only spent 10 seconds on the recall one, so you're fine. But I think that the bigger thought there is that if you're spending more than a minute, then you may be thinking too deeply into it, right? You may be reading too much. Maybe if it's not a math or a environmental question and you're spending more than a minute, maybe take a step back and think again because some of those shouldn't take that. So I do think that 1 minute is actually a pretty good idea. So
Yeah.
okay.
And you can always flag them and go back. So if you're like looking at a question and you're thinking, I don't know this, and you spent like 30, 45 seconds just thinking about it, flag that question and move to the next question. And then you can spend more time on that question at the end.
Great call. Great call. And I did do that as well. So, because some of them you'll just breeze through and you'll know easier, right? And that's fine. And some of you may get caught up. Remember, the exam isn't like all law and then all communication and then all leadership. It's going to be in between. So you're going to have questions that are going to go from um, what is the purpose of public health, or what's the definition of public health? Which we all know is work, play, all that good stuff in the best possible place. Then you're gonna have something that's gonna ask you about the type of mosquito that causes dengue fever. So you may need to take a little time between those two. Okay. All right. Uh
You ready?
yeah. So, and being international, again, we have lots of international. We have actually several of our exam writers are international public health folks as well. And again, there's going to be certain sections where it's going to be a little more US centric, like this section. But generally speaking, it won't be. And the thing is, we give you the tools to study what you need, right? So it's just like going into any other exam with new material that you learned recently. It's the same thing with this, right? So you'll learn a little bit about some of the US specific laws and things like that. And I think, and I'm slightly biased, but I think that the US centric stuff are things that are good for you to know as a public health practitioner internationally. And I think it's things you may have heard of before. And once you like breeze through or read through a book, or you may be like, oh, I get that. I understand it now. Or you may not, and that's okay too. And we are aware of that, and we are doing our best to try to make it less and less US centric. We really do something we try. It was not perfect yet, but we are. And once you get certified, you can come back, help write some exam questions, and help us be less US centric. So good
And
to
then I think
go.
if you have questions about what is on the exam, or if you're looking for like understanding, I would definitely check out the different study guides we have, because have a good synopsis of the section, so they'll cover a little bit more of that if you are less familiar with U.S. law, and understanding the um, different sections and stuff like that. So those are always really good to review. And then just going through the practice questions too, if you find those easy or difficult, or you'll figure out which ones you need to study more.
And to be fair, a lot of us U.S. practitioners don't know a lot about U.S. law either. So you're not alone.
Yeah.
There's a lot of people on this call that are looking at some of these same things like I have no idea what they're talking about, and that's fine. That's fine too. So you're not alone. Okay, let's see.
All right,
So when
ready.
conducting a research study, which of the following is a unique requirement when the study involves human subjects? So when you're doing a research study with human subjects, all right. Yes, 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 yes. Okay. Don't need to explain this one too much more. Things like, yeah, IRB. Again, in general, and on the exam and in real life, when you see human subjects, think IRB. Um, yeah. So IRB is for that. Here's the explanation again. I think most of us got this right, so I don't want to dwell here too long, but human subjects. Okay, and actually, I will leave just any to make sure there are no issues or questions on this for a few moments before I move on. All right. So we're going to move on to the next question. Again, my numbers are not lining up with those on the screen. I apologize for that. Um, all right. So, may a state officer or employee of a regulatory agency concurrently conduct an outside, so private business, or accept outside employment? So this is about conflict of interest, right? We talked real briefly about that earlier, but this is about conflicts of interest, which again is an ethical, another aspect of the ethics part of the exam. Okay, so we have a few different answers here. All right. So the answer is yes, provided the outside business activity is unrelated to the area that he or she regulates. Um, so yeah, you can if you are a member of an organization, state organization, federal organization, and you want to start your own business, that's fine. It just cannot be in competition for, again, obvious reasons. So that doesn't mean that like if you are a public health doctor, you can still be a bartender on the weekend. That's fine. Um, no issues there. All right. Okay. Any issues or questions on that? Uh, all right. Okay. Next, to conduct an individual interview with an unemancipated adolescent aged 14 to 15 for a study in diabetes, for a study on diabetes in high school students, from whom must the researcher gain consent, assent, and or permission according to the ethical practices outlined by the Office of Human Protections. Now, before you answer this question, I want you all to take a second, read through it, and find out what it's asking, and find out if you know what they're asking. Because what they're asking about for this age person, consent, assent, or permission, and or permission. So think about what that would be, right? Without even knowing what the Office of Human Research Protections is, you should be able, I would hope you should be able to think this one through, but let's see what we got. This is one that people sometimes get wrong and like, oh, I get it now. I know where it's coming from. So I want you to take an extra second to think through what the question is asking. This is one that was retired that I actually really, really like, which I really like. So I didn't write it, I don't think. All right. So got a little, hold on, wait, my mouse is a little more sensitive than I remember sometimes. Okay. Teenager and parent or guardian. Now, the reason for this is the question, and I want to go back to the question for just a quick moment, is it says unemancipated adolescent. So that means it's a minor, the minor that has a guardian. Study on diabetes in high school students from whom the researcher must gain consent and assent. So consent needs to come from the parent because the child is not able to consent on their own, right? They're not at the age or have the ability as an emancipated adolescent. Um, there in the new exam, I wouldn't have put that. It would have just said a 14-year-old kid. Like the unemancipated really just double negating, making it out. Anyway, but then assent, meaning that even though the parent has given you the ability to do this, giving you the consent, you still want to make sure that's okay with the student, right? Because we don't want to force stuff on people that don't have the legal ability to consent because of their age or because of, it could be anything, an ability issue, an age issue, any of those things. So we want to make sure that they're also okay with being a part of this research study. So that's why it's consent and assent, right? Parent or guardian is fine for consent, teenager only for assent, but together you want to make sure you have them both. All right. And that's what, and then add in the and or permission because it's lost stuff. So yeah, oh God. The age of consent is defined. I think it may be like 14. I'm sorry, I don't have it right in front of you. I think it is like 14 or 15, but it is defined. Um, and really it's dependent upon, so this is a bigger thing, depending upon like what they're checking for and things of that nature. This is a research project. And so I think it is defined at like that 14-year age range. Um, but the key thing being there again, an unemancipated. So that's telling you that it's someone that would be a minor otherwise, right? Because if it was someone that was at the age of consent themselves, then they wouldn't need to be stipulated as emancipated or not. Um, so okay. All right. Any other questions on that one? We get it there. So like whether it's a 12-year-old or 15-year-old, the fact is it's not an 18-year-old who can give consent to being part of a research study. That's the thing. It's not medical treatment, it's research. So all right. Okay. So I'll fill in the blank here. You will get, I think there's still a few fill in the blanks on there. So you'll get some of these. Income, interpersonal stress, and education level are all examples of blank, which determine the overall health and quality of life of our communities. Oh, okay. Wow, I didn't realize it popped up. Sorry. Yep, social determinants, pretty good here. Environmental determinants would be now this is social determinants. Okay. Um, all right. And then I think this is our last one. Okay. So blank follows the principle that everyone deserves equal rights and opportunities, including the right to good health. Now, don't overthink this. This is one that people often miss because they want to put in something different. Read it through. Think about what kind of test you're taking. Think about what section you're in. This one can be kind of hard too, but I think you got it. All right. So, social justice. So, oh, this is the first one where everyone didn't get most people didn't get it correct. That's okay. So let's read the question again. So, blank follows the principle that everyone deserves equal rights and opportunities, including the right to good health. Excuse me, a lot of people put in human right, which health is a human right, but that's not what this is asking. It's asking, if you put it in human right follows the principle that everyone deserves equal right, right? That doesn't flow. Social justice follows the principle that, so what it's saying, social justice is when you're giving, actually, I'll just let you read it yourself. Human rights are rights inherent to all human beings, regardless of race, sex, nationality, ethnicity, language, religion, or any other status. Everyone is entitled to these rights without discrimination. Social justice attempts to prevent abuses of human rights. Civil liberties are protections against government actions. Civil rights are the rights of the citizen upheld and protected by the government to promote equality and or equity. Okay. And with that, that is it. Now I'm happy to go back and look at any questions you need to again. All right, let me go back and actually leave this here in case people had questions on this because we had a few that were off. I think that, and again, human right is one that the obvious is what people often choose because you hear human right, but that's not what the question was asking. So just as a reminder, even though you may think you know right away, just make sure you're answering what's actually being asked. We um we do our best not to trick you, and that one may be in tricky-ish. You probably have different distractors in it now, but you want to make sure. Oh, my pleasure. Happy to yeah, the answer is social justice. So yeah. Okay.
Okay,
All
do
right.
we have any
Well,
other questions for Rich?
yeah. Anything else for me? Again, my advice to you would be to take take practice exams. That's why I did take a bunch of practice exams, stuff I didn't know. I read up on stuff I did know. I double checked because you don't want to focus so much on everything you are trying to pick up that you forget the stuff you already know. So don't forget to refresh those skills as well. But yeah, best of luck to you all. It's great. You got it. You got this.
Yeah, you do. All right. So if we don't have any other questions, I just want to say a special thank you to Rich. Thank you, Rich, for being here today. And thank you for everyone who's attended. I hope to see you on Thursday for our second to last session, which is going to be program and resource management. So I look forward to seeing everyone back here. Thank you. Bye-bye.